Hello, good day, everybody. Thank you for joining this TDR webinar on communicating research findings for evidence-informed decision-making in public health. I'm Rob Terry. I'm one of the managers in TDR. I look after knowledge translation, so the subject of our talk today. Please be aware that we are recording this session, so if that's a problem for you, then you may wish to perhaps leave, but we will be recording and that recording will be made available publicly later in the week. Okay. You probably have noticed that we disabled the chat. That's because we have an extremely high number of people on the webinar at the moment, but what we encourage is that you put questions in the Q&A. And also what you can do is you can vote, upvote a question that you would like us to tackle later. So please do use the Q&A function for putting your questions in. So we have a small introduction, and then there'll be a presentation from myself, just giving you an overview of the course. And as you can see, we have some panel members that we've brought together just to give us their overview of communication and the importance of communicating research findings. We also have one of our alumni from TDR, Hawa Ahmed, and she will give us a brief intervention. She's been one of the people that actually took the course as a face-to-face course, so we'll hear from her later. We anticipate maybe about 30 to 40 minutes of chat, and then the remainder of the time will be for Q&A. Okay, so first of all, I'd like to introduce the unit head for research capacity strengthening here at TDR. This is Anna Thorsen. So Anna is in Senegal, if I'm right, today. So hopefully her connection will be strong. We just tested it and it was good. So Anna, over to you, please.
Thanks so much, Rob. Very happy to be here, and I hope you can all hear me well. So, dear participants, fellow colleagues and learners, you are most welcome to this webinar. And we will introduce here, as you heard, the TDR massive online open course on communicating research findings for evidence-informed decision-making in public health. Stumbling on those important words is maybe a sign of their importance. This is really the key to bringing your research results into action, of course. I am Anna Thorsen, head of the Research Capacity Strengthening Unit at TDR. And TDR is, of course, the special co-sponsored program for research and training in tropical diseases. We are hosted by the WHO and co-sponsored by the UNDP, UNICEF, and the World Bank. Within the Research Capacity Strengthening team, we work to enhance the abilities of individuals, communities, and institutions to conduct and use health research across the domains of clinical, community, and implementation research. We are focused on 4 strategic global health challenges: the impact of climate changes on health, epidemics and outbreaks, elimination and control of infectious diseases of poverty, resistance to treatment and control agents, and overall applying a One Health perspective to these health challenges. Together with our partners, the TDR regional training centers, and where I'm actually with the UCAD training center in Dakar right now, we work with online and hybrid courses and within regional or sub-regional networks to support capacity strengthening. So we have, for example, a series of massive online open courses and modules that are covering implementation research in the context of infectious diseases, including both general and more in-depth courses. And you will find our repository of different training tools, including also the very popular implementation research online toolkit, a completely self-paced module where you also can find specialized modules on, for example, One Health or intersectional gender effects in research. So please follow the QR codes that will be displayed in the slide and the links in the chat. And for more of the massive online open courses, please go to the video-based trainings and access the links there through the QR code to find many more of the massive online open courses. I wish us a very successful discussion today and look forward to hear from all panelists and then in the end, lots of questions and answers. Thanks so much.
That's great. Thanks, Anna. Okay, I need to share my screen. So, all right, thank you. Okay, if you could just, somebody can confirm they can see everything. All right, good. What do you see it as? Do you see it as the notes section or? You can do it as a single page.
Yeah, I'm seeing it.
Okay. Let me just start again. This is what I was hearing. It's not going to hurt. I'll show it like this. Okay, I'm going to have to remember. Okay, so let me just get rid of the floating panel. Great. So I'm now going to give a very short overview of the course. It'll be about 5-6 minutes. And as I said, this is on the communication of research findings for evidence-informed decision-making in public health. So, as we know, evidence alone rarely influences change. And so what that means is that we have to use communication to effectively say what we need to say. And it was actually Aristotle that many years ago actually first started this. And his philosophy was very much around if you want an effective communication, you need three things. You need to speak to the head, the heart, and have trust. And so when we speak to the head, we talk about the use of the research method and the use of research evidence. When we speak to the heart, but that's not enough. What we also need to do is speak to the heart and use emotion. We need to tell a story. Why is something important? What do we need to do about it? And who suffers if we don't make a change? And finally, we need a credible source of that information. We need to be credible so that people trust us, they believe us, our findings are presented honestly and ethically. And if you put those three things together, what you have is something very similar to a three-legged stool. And the important thing about a three-legged stool is it doesn't wobble even on an uneven surface. So here is our sort of communications theory of change. So this is what we're seeking to do with this course. We're aware that we need to communicate our research findings to different key stakeholders. And people receive information in different ways. So we need to use different formats. Brief written handouts, presentations, the use of video, and even oral presentations, when we're having a conversation, perhaps at a conference or somewhere. And the purpose of that is to enable the uptake of the evidence with the aim that it will influence behavior and policy. Now, this course was first developed in 2019 by TDR as part of our structured operational research training. And it was first presented as an online, as a face-to-face course, and we still present that. We've run this course with over 150 participants. Many of them are frontline workers within health, within agriculture, and within environment. And often they're using what we call operational research with local data to answer local questions. That's the background, but this course, the way that it's written and presented, is beneficial for anyone who's looking to communicate their research findings. So what are we talking about today? Well, we're talking about a new version of the course. It's an online course. It's self-paced, which means you can choose when you participate and you can come in and out. And it's free. It's a free course. The total amount of video lecture time is about 3 hours, just under 3 hours, I think. There are quizzes to test your learning at the end, and you will receive a certificate of completion if you score over 80%. Also on the platform where the course is located, you'll find additional resources, references, templates, and such like. And our objective here is that participants will learn a structured approach to translating complex scientific evidence into clear, persuasive, and actionable messages, tailored for diverse audiences from policymakers and frontline health workers to community stakeholders. So how do we do that? What are the tools that we're talking about? We have 6 different sort of tools that we talk about in the course. The first one is stakeholder mapping. And how do you map your stakeholders and use that to prioritize your communication plan? The second tool is what we call an evidence brief. And we call it an evidence brief because typically this is summarizing the findings of a single piece of research. And it's generally a one-page plain language handout. And what we recommend is that there are 3, maybe 4 key messages that highlight the implications of your findings and the recommendations. And the template is very, very simple. So what did we do? What did we find? Why does that matter? And what are we going to do about it? So next, we provide some support for how do you create a presentation and slides. So we have 2 types. One is a 10-minute technical slide presentation. So you use your visuals to communicate your findings, possibly at a conference, to a peer group, or at meetings. But also what we talk about is something we call the lightning presentation, and that's because it's very short. It's less than 3 minutes, and it's intended for short sessions, for online meetings, and it has the headline message up front. What we've also found is that when we video these presentations, they're extremely amenable to that. And in some instances, in some journals, we've been able to embed those video presentations under the abstract of the published paper. So another form of communication, if you like. Finally, we then also talk about what we call an elevator pitch, which is a short oral presentation that you would use in networking. And it's not so much a presentation, it might be something you're having a conversation with somebody that you've met in a coffee break. And yeah, it's an elevator pitch because it's about the amount of time it may take for you to travel 4 or 5 floors in an elevator to get your ideas across. And finally, we do a little bit around media and social media posting and tips and how to work with journalists. That could be a whole course in itself, and we just cover that briefly towards the end. So what I want you to sort of realize here is that these tools, they act like bait. Each tool is not the full story of your research, but what they are intended to do and what they're designed to do is to attract interest. And what you really want is to encourage the stakeholder to want to know more about your research. So either that may mean like they actually read your research paper, or they might ask you to come and give a presentation, or they even begin the dialogue of the actionable recommendations that you said. Okay, so these are very simple tools, but they're effective. As I said at the beginning, we've used these in over 15 courses, and we are beginning to build up an evidence base that shows the impact of how they're being used. I'd just like to acknowledge the people that helped put the course together, and a particular highlight there is Jamie Guth from Global Health Connection. She project managed the whole of this course. We also had some input from Mike Penkunas, who's an online content expert, and then all of our MOOCs, the training courses that TDR are housed at the École Polytechnique Fédération de Lausanne, and they helped us record the videos and put together the material that you see on the platform itself. So a big thanks to them. I'm just going to put up now some resources. So here you can see, if you either take a quick photo, you'll have the URL, which you can register for the course. The course is open as of today, or you can scan the QR code there on the right-hand side of the screen. And if you're interested, and I hope your interest has been piqued and you do register for the course, you will find, as I said, the slides, the material that I've talked about today, but also the other resource material that's available. And as I said, this grew out of our structured operational research training, but this course has been is very much applicable to a One Health approach or to other areas as well. But if you're interested in what we do with our operational research, then here is the link to that. So that's really all I wanted to say. I'm now going to stop sharing, and we're going to move on to one of our alumni. So Hawa Ahmed. Now Hawa, she did one of our face-to-face courses. I mean, the content is broadly the same, but we thought it would be helpful for you to hear from Hawa. She is a microbiologist. She works in Ghana for looking at the quality of water in Ghana at the Water Research Institute there. And she's just got a few slides just to explain how she has used the tools and the course. So Hawa, I know you've got a couple of slides. Maybe if you just want to share those and we'll hear from you briefly.
Yes.
Okay, that's great. Just make it into a presentation.
Yes, Rob. Thanks, Rob.
Thank you.
And thank you for inviting me to share my experience. My name is Hawa Ahmed, and I'm a microbiologist working with the Council for Scientific and Industrial Research, specifically the Water Research Institute in Ghana. In 2021, I joined the SOTIT, and my research was on investigating the presence of antibiotic-resistant bacteria in drinking water from the Greater Accra region in Ghana. Based on our findings, we had three main recommendations for our key stakeholders: to organize community awareness on AMR and the need to use some form of water treatment for the drinking water at the household level, to expand the research to include more regions in Ghana, and to include AMR surveillance in routine water monitoring programs. In 2022, October, we had the training on research communications and produced a policy brief. We also made a 3-minute lightning presentation, which is available on the TDR website. In May 2023, we had the SOTIT dissemination program, where we invited our key stakeholders and gave a 10-minute presentation. At this meeting, the representative from the Ministry of Water and Sanitation got interested in our findings and invited me to present to the technical group on water at the ministry. This was in August 2023. After this meeting, I was invited back in September to present at the stakeholder meeting for the water safety campaign. This was a strategy to use my findings as an evidence-based approach to get investments for the campaign. One of the stakeholders at this meeting was from the FDA and subsequently invited me to present a poster at the first Ghana FDA Scientific Forum. These have been the outcomes from this training, and it has helped me to carry across my message clearly for my target audience. Thank you, and I'm happy to connect and share more details later.
That was lovely, Howard. I'm just wondering, maybe just briefly put your camera on if you're able, because that was a great presentation, just so we get to see you. Lovely. Thank you, Howard. Okay, I've just been told that there's a few hands up and what have you. What we said, because we've got nearly 1,000 people online, the chat function isn't really working. We've disabled it. So if you have a question, then we really strongly encourage you to put it into the Q&A section, and that's how we will try to collect your inputs if we can. Okay. So that's how we're dealing with that. We're just going to hear from our panelists now, just some more reflections on the importance of good communication within the research area. And first of all, we're going to hear from Christine Karima. She's from the Global Health Network in Africa. So Christine, can you hear me?
Yes, I can hear you great, Rob. Can
Great.
you hear me?
Thanks, Christine. So, you're a regional manager for Africa at the Global Health Network. So what are some of the challenges you've observed with respect to research communication? And maybe could you also share a success story where communication helped influence health policy or practice in your experience? Please, over to you, Christine. Aha, I think we've hit our first technical, but you've just frozen at the moment to come online. Hang on, Christine, we're losing you, I'm afraid.
Can you hear me now?
Yeah.
Okay, great. Thanks, Rob. I was just saying this is such an important and very needed training on communicating research evidence. So from my experience working with various teams, research institutions, and also more importantly, working with individual researchers from across Africa, I think one of the biggest challenges with research communication is not actually the absence of good research. There's a lot of high quality, excellent research taking place in Africa, but it's rather the disconnect between researchers and decision makers, which is something Hawa has been able to do. You've seen how she's been able to take her research from the lab, from what she was doing, to then translate that to those who are decision makers. I think too often we find that our findings remain in academic journals or in very technical reports, and that tends to be quite difficult for policymakers or for frontline healthcare workers, for example, or even to communities that we serve to either access or interpret those findings. I think another challenge that comes to mind is also timing. A lot of our policies here in Africa also tend to be affected by politics. And so sometimes you also have to think about when it is that you're sharing that so that it's meaningful and also that it reaches the right audience when it's most needed. And then I think just as a final challenge that comes to mind is also the capacity, which is exactly what this course aims to fulfill, is really providing researchers with that training on how to then translate their findings to very clear, very actionable messages so that they're able to communicate it and tailor it for the right audience. In terms of success stories, we have quite a number, especially at the Global Health Network, but I think one that comes to mind is, and I like to highlight this example quite a bit, is we work with a particular network, an outbreak preparedness network in West Africa. And during the Ebola outbreak a few years ago, we worked very closely with the local researchers, as well as health workers who are frontline healthcare workers who were on the ground during the outbreak, who were able to generate data very quickly, but also importantly communicate it to the different authorities, whether it's the ministries of health or national governments, and that brought about a lot of action. So I think this evidence really shaped how those countries in the West African region were able to strengthen how they prepare and respond to outbreaks. So it's really not just about the quality of the research, but also how it's packaged, therefore, whether this is through what you were talking about, the concise briefs, real-time updates, and also the direct engagement with ministries, as Howard's talked about. So that's just very briefly to show how important it is to also bridge that gap between researchers and decision makers. And that's what this course is intended for. So I hope many more researchers find value from this. Thanks a lot, Rob.
Thanks, Christine. That's great. And if people aren't aware or they haven't heard of the Global Health Network, I would strongly recommend that they find the resources online. There's a lot of additional sort of training and support material there, which I'm always directing people to. So I'm now going to invite Natalia Pasternak and her cat, if it's a he or a she, if they're still around. Great. So yes, there we have it. Excellent. So as a microbiologist and president of the Instituto Questo de Ciencia in Brazil, you are a passionate advocate for the importance of clear science communication, especially in the face of misinformation, which poses a real threat to public health. So, Natalia, can you share with us an example where science communication successfully countered misinformation and what strategies or collaborations made it successful? Okay, over to you, Natalia.
Thank you so much, Robert. So I'd like to tell two cases in Brazil that were successful at my institute. It's an NGO that promotes science-based public policies. And we launched the institute 1 year before the pandemic hit. So we became very quickly like the go-to institution to clarify scientific evidence, both for the public and policymakers. But we had two big problems in Brazil. We were under Bolsonaro's government, and this government was promoting the use of hydroxychloroquine for COVID, and also questioning the efficacy and safety of COVID vaccines. So misinformation was coming from the top, and we were like the perfect institution to counter it. So we did. With hydroxychloroquine, what we did was that we were on the spot when the first papers and newspaper articles talking about hydroxychloroquine as a possible cure for COVID started coming out. So we were on top of that. We were the first. We have a magazine, an online magazine, and we have a very good relationship with the press. So we published the first newspaper article explaining the methodology flaws in the hydroxychloroquine studies that were promoting it for COVID. So we explained all the flaws, we explained the difference. It was a great opportunity to explain how a clinical trial works and how we can separate what works from what doesn't. So we use that to educate both the public and policymakers. And we have, because we have a very good relationship with the press, journalists were coming to us to explain the scientific paper so that they could then write their own articles for national and regional newspapers. So we changed the public debate about the use of hydroxychloroquine, even though this misinformation was coming from the health ministry and from the top. We actually, the health ministry was preparing to launch what they called a D-Day for the use of hydroxychloroquine, and it would be this big online event to promote it as a cure for COVID. So we decided to do on the same day what we called the C Day, because science in Portuguese begins with a C for ciência. So we did the C Day, and we also did an online event, but we invited 7 former health ministers to talk to the public together with us and a bunch of specialists to explain why hydroxychloroquine wasn't a cure for COVID. Even before the event, the government canceled theirs. When we started announcing our event with 7 former ministers, the government canceled D-Day. So this was a very successful story, and it made the news. So then we had the event, and we were on the front page of every national newspaper the following day. The other story is about vaccines, because vaccine misinformation was also very big in Brazil at the time. So I had the opportunity to be an expert witness for the Senate when they implemented the Parliamentary Inquiry Committee to assess the culpability of President Bolsonaro in the excess COVID deaths, because he delayed the purchase of important vaccines that could have saved a lot of lives. So I was invited as an expert witness, and I had to explain how we know that vaccines are safe and effective, COVID vaccines. And I think the most important argument that was being used by those propagating misinformation was that very common argument, I had the vaccine and I still got COVID, so the vaccine doesn't work. And I had the perfect opportunity because I was at the Senate, I was talking to legislators, and it was being watched by millions of people in Brazil on live television. So I used an analogy with football, soccer, because Brazil is, as you know, very big on soccer. So everybody knows the rules, everybody loves the game. And I explained that the vaccine was just like a goalkeeper. And this became known as the goalkeeper metaphor, and a lot of people used it after me. So I explained that the goalkeeper doesn't play alone. And a vaccine is the same. It depends on the environment. So if the goalkeeper, even if he is a good goalkeeper, and there are too many balls coming in his direction, and the defense of the team is really bad and nobody's doing anything to help, some balls will get through. And people seem to get really that analogy, and journalists started to use it. So this was a very successful story in communicating science in a way that everybody can understand it, and you also change the public debate. So when we're talking about science communication, we have to change the public debate so that the public debate can help us to influence policymakers. And this is what I have been doing in Brazil with the Institute Question of Science.
Great. Thank you. Thanks so much, Natalia. And I think we heard there a really good example of, where credibility comes in. You are a trusted source of information. You were able to present honestly, without perhaps an agenda. And, I think that, that helped to kind of get your message across. So I really appreciate that. So we're going to have one more intervention from Adana Wamamwe. She's a senior lecturer at the University of Ghana School of Public Health. Are you there, Adana?
Yes,
Yeah,
I'm
I
here,
see you. Okay, and I hear you. Lovely. So the University of Ghana School of Public Health is an important partner working with TDR on research capacity strengthening initiatives. So could you share some recent efforts or innovations at the university aimed at enhancing research communication skills among students and researchers? And in your view, how does the new TDR MOOC contribute to the research communication process? Over to you, Adana.
All right. Thank you so much, Robert, and welcome to everyone here in the webinar. With regards to the students and researchers here in the university has several workshops that they run to improve on scientific communication amongst the students and lecturers. The last one that happened in September, where the Public Affairs Directorate put together a communications workshop that was attended by different units in the university. So that's one thing that is done on a regular basis. Bringing this closer home to a more perhaps personal level, there are also several projects or research projects going on the campus. And for each project, also they have their own individual ways of improving research communication, because of, every researcher wants their work to be meaningful and to make that impact. So they do several things to make that happen. I'll give an example with the project that I'm involved in, where we have a research uptake unit, and the research uptake unit, they are focused on facilitating the use of the research evidence by policymakers, by practitioners and other development actors in here in Ghana. So the research uptake unit produces peer-reviewed work, blogs, visual aids, and case studies, newsletters, anything that we can use to reach to various stakeholders, depending on what they need to hear and what kind of actions that they can take. Apart from that, we also have in-house capacity strengthening for the research team, so that they can also individually articulate. We've talked about lightning communications and the pitch. So you need to, because you don't know where you're going to be at any time, so you need to be ready every time. So and then we also have the media engagement. I was happy to hear I think it was Natalia that was talking about engaging with the media. That's also something that we take very important. We've had media engagement and media training. And the interesting thing is that the media training was both ways. We training the media on what we want to say and how we want to have it said. And then the media training the scientists on how to say it well to get to the public or to whoever you want to reach. So it was a very interesting cross-learning at that training. The second part of your question had to do with how this MOOC is important in research communication. TDR has a lot of MOOCs that teach implementation research, operational research, and then One Health. So, the first thing about getting your research out there communicated is to actually know what to do. And all these MOOCs that TDR has available to different learners, and the interesting thing, free to different learners, is that you get to know what to do, because you have to know what to do for you to be able to now communicate that evidence to inform or to influence health system interventions, policy, or programming. So with this current new kid on the block, which is the MOOC on research communication, after you know what to do, how then do you best get that information out there? So this MOOC will be very important in sharpening those skills. You've done your work, you've done your research, you want to make that impact, get the skills to get that impact out there. Thank you, Rob.
Okay, thank you. That, yeah, really nice. And again, I think you were reiterating there. When we think about communication, we've got to think about as many different ways to get the message across, whether it's through blogs, whether it's through briefings, whether it's face to face. And I think the other thing which very much resonates with me is just being ready. There's often this thing called the window of opportunity, and if you meet somebody at the right time and you're primed, you know what you want to say in a very short order. Then that's your chance. So thanks very much. That's really great. Okay, thanks very much for those inputs. I can see we've got quite a number of questions coming in. I'm going to take the first one, and then I'll read the next question out for the panel and give you some opportunity to think about it. So the question to the panel, which I'll let you think about, and then I'll answer another question, is: we see around the world quite a resistance to the use of evidence or even experts in policy making, and that's a challenge. So how do you see that trend changing, and what things are you likely to be using to try to counter that? So I'm just going to leave that with you for a few minutes, just to try to think of some replies. One of the questions is talking about resources and the resources needed to translate research into evidence. And I accept what we're doing here is a free course. It's available online, and therefore we are trying to support that capacity. We run fun face-to-face courses, but it's never going to be enough, no matter how many courses we run and how many people we try. So that was one of our sort of responses to the idea that there's not enough resources out there. What I would say is that in actual fact, having completed your research, spending some time working out who needs to know about the research and how they want to hear about the research. It's not hugely cost. It's not a lot of cost that you need to invest, but there is some time. And all I would say is the tools we've put out there are very, very straightforward, very simple. And writing, getting into the habit of writing a plain language summary of your work that you can then use as a calling card with others is all it really requires is effort on your part, not necessarily huge amounts of funding, although I accept that is always likely to be a bit of a challenge. There was a bit of a follow-up question about other languages. So the course itself was recorded in English, but it is also subtitles are available. You can choose Spanish and French as well. So you should be able to access, at least you can hear the English and see the subtitles in those two other languages. Great. I'm going to go back to the panel now, and the very hard question, I think, that I put you, which is change is at the end of the day, change is political. And we've seen a bit of a change in certain countries, more than others, where there's been a resistance to the use of evidence. I'll be interested to know your thoughts about whether that's a trend you see is growing, and what type of strategies you're thinking of putting in place to try to counter it. So who feels brave enough to have a go at that one? Adana, you're nodding. I'm going to go to you.
Yeah, I think that's a very interesting question, and one that has really created a lot of anxiety for so many researchers. I think using still the same research work I had used as an example, as I exemplified earlier, stakeholder engagement is a big deal, and I think a lot of people overlook it. And actually doing that important analysis of your stakeholders helps you to really narrow down on those who can actually make that shift that you need for your work. So with regards to the research I earlier quoted, what we did was to engage these stakeholders early at the beginning, from the get-go, so that they were and part and parcel of the process, and that at every step they were updated on what was new and where we were headed. And so in that way, they felt like they were part of the process. And when it came to the point where something could, some of our evidence could be used, they invited us. We had at the time a revision of the training manual for community health officers who are at the basic level of primary health care. And because of the evidence briefs that we had been sharing with these various stakeholders, first of all, you need to be sharing with stakeholders who can actually do something about the evidence that you are generating. And so because of this information they already had at various stages along the line during the research, then the team was invited to make an input into that revised manual for training. So it's things like this, knowing who should be engaged at the beginning, engaging that or those individuals early in the process, and then keeping them engaged throughout the process. So that's one way of encouraging, or this one way of discouraging the resistance that comes with the use of evidence. Yeah, thank you.
Thanks, Adana. I mean, one of the areas that we actually talk about in the course is that often we tend to speak to people who share our point of view. And when we are talking about stakeholder mapping, we very much emphasize the need to try to seek out those that are likely to oppose what you're saying. Now, it may not be they're opposing it on scientific grounds. It could be your recommendations require greater resources or more staffing, and so there'll be sort of budgetary constraints. But you should definitely seek out those people who are likely to resist any recommendation and see how you can discuss with them. I see a hand from...
Yes, very,
yeah.
yeah. Okay, sorry. I was going to just say that that's very important, because sometimes those who resist are able to tell you why they're resisting and what you can do differently to get your work to be put. Yes, thank you.
Thanks, Adana. So, Natalia, I see your hand, please.
Yeah, so I was talking before about how important it is to influence public debate. And one of the things that we also do with my institute in Brazil is to train journalists. We provide training workshops together with the big newspapers. And we provide training specifically for science and health journalists on how to report on scientific consensus and evidence. And this can be tricky because journalists are trained to always give the other side. And it sometimes leads to a false equivalence in science where, for instance, if you give the other side, you're talking about the shape of the Earth. And you maybe call a physicist or an astronomer, but then you also call a flat earther to show the other side. So this can be tricky this is a very silly example, of course, but just so we understand the ethics of journalism, because journalists are trained to do that. And we explain that when we're talking about especially health communication that can actually change behavior and put people at risk, you have to be very careful how you present the evidence, and you can't really risk presenting it with a false equivalence. So this is one of the strategies that we use to try to get the message to the public in a way that everybody has access to scientific evidence in a way that they can understand it. The other thing that we always say is that, yes, countering misinformation is hard. It requires a lot of work and a lot of repetition, but really it requires that scientific-based information is circulating, it's easy to find, and it's easy to read and understand. And this is our job as science communicators. We have to be able to translate science in a plain language that everybody can understand, the general public, the specific stakeholders, policymakers, and we have to make sure that it's circulating, that it's accessible, and it's easy to find. And once we cover that, then yes, maybe we will have to do specific targeted countering of misinformation, but we also have to be careful not to be fooled by very loud minorities on social media and do like this big effort in countering misinformation that it's really not that spread in the public debate. It's very concentrated in bubbles in social media, and maybe we shouldn't waste that much time countering that because it's not really widespread. And there are fact-checking agencies that can really fact-check the spread of misinformation. So we also work closely with them.
Yeah. No, I think that's an excellent point. It's really doing your stakeholder mapping and trying to identify, who's likely to amplify your message and who's likely to try to dampen it down and oppose it. And we definitely talk about that. I think that's a really good point. And there's a few questions I see in the chat, like specialist groups, like in the question there's one around how do we work with maybe a more elderly population who may well be resistant to certain new treatments, particularly say vaccines. And I think the starting point for that type of a conversation is to really understand what are the reasons for the hesitancy. Is it a risk aversion, or is it because they're concerned about their own health or those types of, and understanding why somebody has a point of view before you try to counter it is extremely valuable, because otherwise if you immediately start to oppose, then you end up with this kind of division of ideas. Okay. The other question I saw was really around, the difficulties of accessing health information generally, and particularly when a lot of research is hidden behind paywalls. I can't give a simple answer to that. I can only say I've been working for more than 30 years on open access. Everything we do in TDR is open access. This course is free. And it's becoming slightly easier now with the use of preprints. So you can normally find a version of a printed of a research paper. You can normally find a version online through one of the preprint servers. But I admit it remains a challenge, this kind of universal access to health information. And certainly within TDR, we will continue to champion all things open wherever we possibly can. I don't know, Christine, I didn't know if there was a perspective you have from, say, the Global Health Network and your thoughts about how this trend of opposition to sort of evidence-based decision making, where it's likely to go, and what you think you could do to counter it. Christine.
Thank you, Rob. I apologize. There's a bit of background noise on my end, but I hope you can hear me okay. No, I think everything you've highlighted, as well as Adana and Natalia, are similar to what we see. And I think Natalia said it quite well, is that in some cases, some of this resistance tends to be quite concentrated in certain areas. So it's really important. And I think a great component of this course is stakeholder mapping, because while we're thinking about who is critical to your research, who would be quite critical in terms of opposing your research, it's also an opportunity to find champions who can help you, go over that bridge and connect to the right people. So that component of stakeholder mapping is really important. And a lot of times you'll find that once you learn how to communicate, once you learn how the right audience wants you to communicate, it tends to be quite easy. So it's really a skill, and that's what this course provides. And I think that's going to be helpful.
That's great. Thank you so much for that. So I'm just trying to ask my colleagues if there are any questions they think I'm missing. Yeah, so there's a question. So Howard, if you're still with us, Howard, there was somebody who was actually quite interested in what you said. So clearly your very brief presentation did exactly what we wanted it to do. Somebody wanted to know more. So that's nice. I wouldn't get too much into the weeds, but what they were asking here is when you presented your findings, it's quite complicated to talk about things like antimicrobial resistant pathogens and what they'd like you to hear from you briefly, if I may, is how did you communicate those complicated ideas, and what was it you think you said that got the interest of the Ghanaian FDA in your work? So a little bit of a challenge there. So over to you, Howard.
Yes, thank you, Rob. I think I must say that the training really played a role, because I remember a session where we had the networking session where we had to speak or talk about our research. And I spoke to someone who played the role of a queen mother and couldn't so I couldn't use the words like AMR and all the bacteria I had, and I had to explain my findings and ask for what I wanted for her to do in her community with regards to the recommendations I had. So I think those were the key things I think played a role in my communications, because at this meeting I didn't even mention Pseudomonas or all the things that I did, but then I was able to communicate the findings clearly and the need for us to like create this awareness in communities. Into my acts too were very direct. I think you had to have like 3 main points to get across, and I think that came across in the training. So I had 3 clear points that I was asking for each person I was talking to, so that came across clearly, and they were readily accepted what I had to say and invited me back to these sessions.
Yeah,
I think
great.
being clear and concise with your acts is the way to go.
Thanks, Howard. And I think I would highlight one of the things, one of the things we're able to do in the face-to-face course is practice a lot. So we get people to present their work more than once. And as Howard said, we create this kind of conference breakout session where we pretend to be different people, whether we're a minister or a funder, and then we ask those kind of hard questions. But the point is, and even if you're not able to attend one of these face-to-face courses, is practice with your peers, practice with your colleagues, and practice with maybe your friends and relatives who are not necessarily scientists, and see if you can explain what it is that you're doing in ways that they understand. And that's the kind of pathway to kind of really effective communications. And you can never practice too many times, I would say. Definitely. So I think we're coming towards the end. I apologize if we didn't cover your question. The recording, and I see there was somebody asking, can we have access to this recording? This will be packaged up and will be available via the TDR website probably later in the week. It'll also be available via our newsletter. So again, if you go to the TDR website, you can sign up for our newsletter, and then you'll be able to learn more about the work that we're supporting, the outputs and impact that it has, and I guess important for a lot of you, the grant opportunities that we are offering currently. Okay, so I'd just like to say a big thank you for everybody who joined me today. Adana, Natalia, Christine, Howard, Natalia's cat, very good. And for all of those of you online, as I said, the other lecturers who gave their time to put this course together, I really hope we've piqued your interest and you want to know more, and that you do register for the course. Like I said, it's free, it's online, and that it helps you in the communication of your research findings. And what we will probably do in about a year's time, if you give us your details when you register, we may well be contacting a few of you just to find out the impact and how the tools that we've given, how they've been used and how they're perhaps improving the situation. So that's it for today. Again, thanks very much for joining. I hope we did have to manage quite a large number of you, so I apologize we weren't able to have the full chat functions and things working, but we got some very interesting questions there. I hope we were able to cover them. I look forward to seeing you on the course, registered at least, and I look forward to seeing how that plays out as we go forward. So thanks very much to everybody. Have a very good rest of the day, and I look forward to coming across. Some of you, our paths may cross in the future. So thank you. Cheerio. Bye-bye.
Bye. Thank you.
Yeah, I think, Tina, you can close the meeting, or at least with the recording. Maybe keep the, yeah, whatever you need to do to keep the recording. Okay, thanks, Natalia. Thanks, everybody.
Thanks, Robert, and everybody. It was a pleasure.
Thanks,
Really appreciate
everyone.
that. Thanks, Adama. Lovely. Really nice input. Thank you.
Bye, everyone.